Hi and welcome. First, I want to thank you for taking the time to watch this video. Today, I want to talk to you about something that affects millions of people, and yet most are given little more than a prescription and a shrug, and that is peripheral neuropathy. If you're here, chances are you've been experiencing symptoms like numbness or tingling in the feet or hands, burning pain or electric shocks, feeling like you're walking on marbles or pins, loss of balance or unsteady walking, cold feet, even in warm weather, or the frightening sense that your nerves are slowly getting worse. And what makes neuropathy so terrifying is it doesn't just hurt, it threatens your independence. People stop walking as much, they avoid stairs, they fear falling, they stop traveling, and deep down they wonder, is this permanent? Is this just going to keep progressing? Am I headed towards disability? Now, here's what most people are told when they seek help. They're given medications like gabapentin, Lyrica, antidepressants, anti-seizure drugs, painkillers. But let me be very clear. These drugs do not fix neuropathy. They do not repair nerves. They do not restore blood flow. They do not address the cause. And in most cases, they simply attempt to numb the brain's perception of the pain while the nerve damage continues underneath. And over time, patients are often told they need higher doses, stronger medications, more side effects, just to keep symptoms tolerable. That is not real treatment. That is symptom management. And I hear it all the time. Doctor, I feel like I'm getting worse. My feet are going numb. I'm scared I'm going to fall. I don't want to live on these medications forever. And you shouldn't have to. My name's Dr. Anderson. I'm the founder and chief clinician of Premier Health of Summit, one of the tri-state area's leading neuropathy and nerve restoration centers. And I developed my proprietary cellular regenerative healing process, which is designed to specifically help people suffering from nerve pain, numbness, and neuropathy progression. For 20 years, we've helped thousands of patients regain sensation, improve balance, reduce pain, and in many cases get their lives back. This is what we do every single day. Neuropathy is not a side issue in our clinic. It's one of our core specialties. And what makes our approach different is simple. We don't guess, and we don't mask symptoms. We identify exactly why the nerves are failing and whether they can be restored, because neuropathy is not a random diagnosis. It's usually the result of underlying dysfunction, such as poor circulation and oxygen delivery, metabolic breakdown and blood sugar instability, chronic inflammation, nutrient deficiencies, toxic nerve irritation, mitochondrial energy failure, loss of nerve signaling and regeneration. And here's what most people don't realize. As long as the nerve is still alive, even 10 or 15%, there is often tremendous potential for improvement. But timing matters. The longer someone waits, the more nerve tissue degenerates, and the harder it becomes to reverse. That's why our program is built around advanced, objective testing. We perform comprehensive neurological and vascular evaluations to determine how severe the nerve damage is, whether the nerves are still viable, what is driving the dysfunction, and whether you're a candidate for real improvement. Because most neuropathy patients have never been tested properly. They've been medicated, but not evaluated. Our goal is to not cover up neuropathy. Our goal is to restore function. Our program is designed to reactivate damaged nerves, improve circulation to the feet and hands, reduce inflammation at the cellular level, restore balance and coordination, help patients walk with confidence again, and prevent the downward spiral that leads to falls, ulcers, or even amputation. And we do this without drugs, injections, or surgery. People come to us every day saying, I thought this was permanent. I was told nothing could be done. I felt hopeless. And then after the right care, they start feeling their feet again. They sleep again. They walk again. They get their lives back. And that is why we do this work. And we've had extraordinary success with the right candidates. So the question becomes, can we help you? Well, I offer an easy first step. It's a free discovery call where I can learn more about your symptoms and determine whether it makes sense for you to come in for a full neuropathy evaluation. During that call, you'll discover whether you may be a candidate for nerve improvement, what could be driving your neuropathy, why medications like gabapentin are not a solution, what options exist beyond symptom suppression, and whether our program can realistically help you regain function. Because not everyone qualifies, but for the right person, this can be life-changing. And I'll tell you what I believe is going on right after speaking with you. Neuropathy is one of those conditions that rarely stays the same. It usually progresses, and the earlier you act, the better your chances. If you've been feeling numbness, burning, tingling, or balance decline, don't wait until it becomes irreversible, because what's most devastating is that it doesn't just affect your feet, it affects your life, right? Because little by little, people start losing things that matter most. They stop taking long walks with their spouse. They hesitate to travel because they don't trust their balance. They avoid going out to dinner because walking through a parking lot feels dangerous. They stop dancing. They stop exercising. They stop doing the things that used to make them feel alive. And maybe the hardest part is feeling like you can't fully enjoy your time with your family anymore. You want to run around with your grandkids, but your feet feel numb. You want to be present, but you're distracted by burning pain. You want to feel confident, right? But every step feels uncertain. And deep down, people start thinking, is this how it's going to be from now on? That is what neuropathy steals, not just sensation, but independence, confidence, freedom, and joy. Call my office today. The number is 908-219-4334. Schedule your free discovery call with me. I'll speak with you personally. Thank you for your time, and I look forward to helping you take the next step towards stronger nerves, steadier walking, and real hope again. Have a great day.